Alright everybody, this is Julian from Raw Physique again. Today I'm going to do a review on melatonin and why this could definitely be beneficial and helpful if you are lifting, trying to build muscle, become a better athlete in general. And I'm going to explain my experience while taking melatonin and lifting. At the moment, I've been taking melatonin on and off for about a year. And so at least with myself, I know what the side effects are and the benefits of taking it. So that being said, let me go ahead and do a quick overview and get on WebMD and read what they say about it. What the online gods say about melatonin. Okay, quick overview. Melatonin is a hormone made in the body. It regulates night and day sleep cycles, and melatonin in supplements like this are usually made in a lab. So, darkness triggers the body to make more melatonin, which signals the body to sleep. Light decreases melatonin production, which signals the body to awake. So, more melatonin flowing in your bloodstream, more tired you are, more likely you are going to be able to fall asleep. Some people who have trouble sleeping have low levels of melatonin. It's thought that adding melatonin from supplements may help them sleep. I wouldn't even say may or might. Definitely helps them sleep. I'm sure there are some cases maybe where it doesn't, but every night owl I know that takes melatonin, it does help them fall asleep at a more appropriate time. People most commonly use melatonin for insomnia and improving sleep in different conditions, such as jet lag, which that does help with. It is also used for depression, chronic pain, dementia, all of which I didn't know about. Maybe that's the dementias, and many other conditions, but there's no good scientific evidence to support most of these uses, except for the jet lag and insomnia. I am the medical evidence that WebMD needs. There's also no good evidence to support using melatonin for COVID-19. What? Well, there goes my fucking Cancun plans. No good evidence to support using melatonin for COVID-19. I don't know why that's even in there. Okay, so as per their website, I'm going to go through this as fast as I can. Uses and effectiveness. Likely effective for trouble falling asleep at a conventional bedtime. Delayed sleep phase syndrome. So helps you fall asleep at a better bedtime. Taking melatonin by mouth seems to shorten the time needed to fall asleep in young adults and children with this condition. Non-24-hour sleep-wake disorder. Taking melatonin by mouth at bedtime seems to improve sleep in children and adults who are blind. I guess, yeah, so the visual cues, just like being on your phone at night without some type of red hue on the screen and taking out the blue light. If you're actually looking at the normal blue light provided by cell phones and laptops, that does actually keep people at night. Most phones and laptops do have, this is off subject, but do have something that you could turn on that's like a nighttime mode where it removes a lot of that blue hue and light from the displays on whatever device you're using. Anyway, back to WebMD. Possibly effective for sleep disturbance caused by certain blood pressure medicine. Beta blocker induced insomnia, basically. Taking melatonin by mouth may reduce sleep problems in people taking beta blocker drugs. Cancer. Taking high doses of melatonin by mouth or as a shot administered by a healthcare provider along with chemotherapy or other cancer treatments might reduce tumor size and improve survival rates in some people with cancer. That's also a new one for me. Confusion and agitation after surgery. If children receiving a medication called suflurane during surgery, butchered that one. Taking melatonin by mouth before anesthesia might help to prevent anxiety and agitation while waking up. Also a fun fact. Oh my gosh. Okay. A painful uterine disorder. Endometriosis, if that's how you pronounce that. Either of those. Taking melatonin by mouth seems to reduce pain and painkiller use in adults with this condition. It also reduces pain in menstruation, intercourse, and while going to the bathroom. High blood pressure. Taking a controlled release form of melatonin by mouth before bedtime seems to lower blood pressure in people with high blood pressure. Immediate release products don't seem to work. So slow release melatonin may help blood pressure. Insomnia, which we went over. Taking melatonin by mouth, short term seems to shorten time it takes to fall asleep in people with insomnia. Yep, but only about 7 to 12 minutes. It's not clear if it affects the amount of time spent sleeping. I'll get into that. It also seems to be more helpful in older adults and those with certain other conditions. Moving on to jet lag. Taking melatonin by mouth can improve certain symptoms of jet lag, such as alertness and reduced daytime sleepiness and tiredness. But it might not help shorten the time it takes for people with jet lag to fall asleep. It worked for me. Migraine. Taking melatonin by mouth before bed can prevent migraines in adults and children. It's not clear if melatonin helps to treat migraines. Anxiety before a procedure. Taking melatonin by mouth or under the tongue somewhat reduces anxiety before surgery in adults. It is not clear if this helps with children. Sedation before procedure. Taking melatonin by mouth might reduce the amount of sedatives needed for some medical procedures in children. Sunburn. Applying melatonin gel to the skin before sun exposure seems to help prevent sunburn. Another new one for me. A group of painful conditions that affect the jaw joint and muscle. Temporomandibular disorder, or TMD. TMD is what I'm going to go with. Taking melatonin by mouth at bedtime for 4 weeks reduces pain in females with jaw pain. Low levels of platelets in the blood. Thrombocytopenia, another butcher. Taking melatonin by mouth can improve low blood platelets counts associated with cancer treatment, and other disorders. All right, so more possibly effective for, this is what we're looking at. Athletic performance. Taking melatonin by mouth shortly before resistance training or cycling doesn't appear to improve performance. Oh, if it makes you tired, that makes sense. Involuntary weight loss in people. Oh, this is possibly ineffective for. My bad. Athletic performance. Of course not. Involuntary weight loss in people who are very ill. Cachexia or wasting syndrome. Taking melatonin by mouth doesn't improve appetite, body weight, or body composition in people with wasting syndrome from cancer. Jesus. Diseases such as Alzheimer's that interfere with thinking, dementia. Taking melatonin by mouth doesn't improve behavior or affect syndromes in people with Alzheimer's disease or other forms of memory loss, but it might reduce confusion when the sun goes down in people with these conditions. Inability to become pregnant within a year of trying to conceive, and fertility. Taking melatonin by mouth doesn't seem to improve pregnancy rates in females undergoing fertility treatments. Sleep disorder due to rotating or night shifts. Shift work disorder. Taking melatonin by mouth doesn't seem to improve sleeping problems in people who do shift work. I did not see that. I don't know. It may help you fall asleep faster, so wouldn't that technically work on a level, if you're trying to fall asleep? Okay, likely ineffective for withdrawal from drugs called benzodiazepines. Benzos. I don't really take drugs, I guess. Taking melatonin by mouth at bedtime doesn't reduce withdrawal symptoms in people with insomnia who have stopped taking these drugs. Depression. Taking melatonin by mouth doesn't seem to reduce symptoms or depression, or might make symptoms worse in some people. Ooh. All right, done with all those. Now we're just on to the quick side effects. This will be a lot faster. When taken by mouth, melatonin is likely safe for most adults when used short term. Melatonin is possibly safe when taken long term. It's been used safely for up to 2 years, but it can cause some side effects including headache, sleepiness, dizziness, and nausea. Don't drive or use machinery for 4 to 5 hours after taking melatonin. I didn't know that. And then when applied to the skin, melatonin is likely safe for most adults when used short term. Just use sunscreen, mineral sunscreen. Some type of sunscreen besides melatonin is the way I'm understanding it. All right, now we're to the precautions and warnings. Pregnancy. Melatonin is possibly unsafe when regularly taken by mouth or in high doses when trying to become pregnant. Melatonin might have effects similar to birth control. Whoa. Making it more difficult to become pregnant. There isn't enough reliable information to know if melatonin is safe to use when pregnant. Until more is known, it is best to not use melatonin while pregnant or trying to become pregnant. Breastfeeding. There isn't enough reliable information to know if melatonin is safe when breastfeeding. Stay on the safe side and avoid use. Whew. Children, melatonin is possibly safe when taken by mouth. Short-term melatonin is usually well tolerated when taken in doses up to 3 milligrams daily in children and 5 milligrams daily in adolescents. There is some concern that melatonin might interfere with development during adolescence. Melatonin should only be used in children with a medical need. There isn't enough evidence to know if melatonin is safe in children when taken by mouth long term. Bleeding disorders. Melatonin might make bleeding worse in people with bleeding disorders. Alright, so it doesn't seem like that'd be good to take it then. Depression. Melatonin can make symptoms of depression worse, which they said earlier, like some of these other things. High blood pressure. Melatonin can raise blood pressure in people who are taking certain medications to control blood pressure. Avoid using it. Seizure disorders. Melatonin might increase the risk of having a seizure. Transplant recipients. People who had a transplant after taking medications to suppress the immune system. Melatonin can increase immune function. This might interfere with the effects of some transplant medications. So, it says interactions with other drugs we are on to. So, moderate interaction. Be cautious with this combination. First of all, birth control pills, contraceptive drugs, interacts with melatonin. Caffeine interacts with melatonin. Fluvoxamine, Luvix, interacts with melatonin. Medications for diabetes, anti-diabetes drugs, interacts with melatonin. Melatonin might lower blood sugar levels. Taking melatonin along with diabetes medication might cause blood sugar to drop too low. Monitor your blood sugar closely. Medications that decrease immune system, immunosuppressants, interacts with melatonin. Medications that slow blood clotting, anticoagulants, antiplatelet drugs, interacts with melatonin. Nifedipine, GITS, interacts with melatonin. Sedative medications, interacts with melatonin. Medications changed by the liver, interacts with melatonin. Medications for high blood pressure, interacts with melatonin. Medication used to prevent seizures, interacts with melatonin. Medications that increase the chance of having a seizure, interacts with melatonin. Methamphetamines, interacts with melatonin. Warfarin, interacts with melatonin. Now we're to minor interaction when taking melatonin in certain drugs. Flumenazole interacts with melatonin. Medications changed by the liver, which they had before, interacts with melatonin. And that's it. We're up to dosing now. So for dosing, which I'm going to go into myself with this, but what they're saying, WebMD, melatonin has most often been used by adults in doses up to 8 milligrams by mouth daily for up to 6 months. In children, it's most often been used in doses 3 milligrams by mouth daily for up to 3 months. Some melatonin supplements are slow release and others are fast release. Some melatonin products can be placed under the tongue or in the cheek to absorb faster. I have not seen those. Melatonin is also used in creams, gargles, and gels. Speak with a healthcare provider to find out what type of product and dose might be best for a specific condition. So that was a rundown on melatonin. Again, I've been taking this for easily over a year at this point. Probably a year and a half to 2 years, honestly. And the way I use it and how it may actually benefit when you're lifting and trying to increase athletic performance and just get sleep, right? Because they say eat, sleep, lift, right? So sleep is 1/3 of what you need to do. That's when your muscles rebuild the most, is when you're sleeping. You have to get a good night's sleep in order to get maximum benefits after a hard exercise and having proper nutrition. So eat, sleep, lift. Anyway, so the effects that I've had taking melatonin. This is by Natural, and I got it off Amazon for probably around 15 bucks or so. I'll post that up here. And these are 5 milligram gummies. So you get 5 milligrams of melatonin supposedly inside of each gummy. Now there were studies done that 2.5 milligrams is basically all someone needs to sleep. When they mentioned 8 milligrams on here, I was really surprised because that's a lot of melatonin. And I think like anything past 3 in certain studies, it loses effectiveness. Well, it doesn't lose effectiveness, but there's no benefit to taking 8 opposed to taking 3. So that being said, I started out taking it just to try to help me fall asleep faster. And it actually It actually does. It helps me fall asleep faster. I don't know why this said only 7 to 15 minutes. I could sit there in bed and think about crazy shit for an hour and a half. And if I take one of these and relax, I'm out in like 15 or 30 minutes. So that's definitely good. If you have a time you have to wake up in the morning, the sooner you get to bed when you go to bed, the better. Which means that your body could actually have more time to recuperate from lifting the other day, detoxing itself, healthy aging, less likely to get Alzheimer's. There's a million things why sleep is good and a necessity, and getting only 6 or 7 hours of sleep a night can have huge effects on your health and long-term health. So that's why something like melatonin can be pretty helpful. So anyway, back to my experience with it. I'll start with, if I take it every single day, then within 5 or 6 days of continually taking it, if I ended up not taking it, I will not be able to sleep. So my body adapts pretty fast to having to take these pills if I take them regularly or like continually every day for 5 to 7 days. So that is something that it is not good, because then you're literally stuck taking this, and if you get addicted to it, or if your body gets addicted to needing this opposed to responding to just it getting dark outside or you getting ready for bed, naturally releasing melatonin, you keep taking this, it will actually have a negative effect. So, at least in my case, and I don't believe I have any of these disorders or anything like that. So let's say average adult. So anyway, that poked a hole in the hull of my ship when I first got these to help me sleep better. What I ended up doing was I started taking these on nights that I had to either wake up really early, so I'd have to go to bed a little earlier than my normal bedtime, or if I ate a big meal right before bed, or was hyped up for any reason right before bed, or like not able to relax and kind of get yourself in the mood for bed, these come in really handy. And the most I'll take is 1 gummy every night for 3 nights. That's the longest I'll go, and then I'll cut myself off at least for a couple days. So I use it very moderately to make sure I don't get addicted to it. Another weird thing I've noticed is if I do take one of these, for an example, like let's say I go to bed at 10:30 and wake up at 6:30. Well, if I take one of these, go to bed at 10:30, and I'm trying to wake up at 6:30, if I wake up at 2 or 3 in the morning, I'm fucking like wide awake. And I can't like go back to sleep. It's a pain in the ass if you wake up in the middle of the night after taking one of these. At least for me, that's a weird side effect I have. If I don't take one, even if it takes me longer to fall asleep, I'll sleep through the entire night. And if I do wake up in the middle of the night, then I'm able to just like pee and go back to sleep or whatever. But after taking one of these, wake up 3 or 4 in the morning, you're roaring to go. And that's actually like a pain in the ass. But if you're like really trying to go to bed and you need to go to bed fast, this does help out, at least for me. Another thing I've noticed is if I rip this in half, so it's 2.5 milligrams, I go to sleep almost as fast as I do taking a full one, except for if I wake up in the middle of the night, then I have a little bit better chance of falling back asleep just by splitting one of these gummies in half. So I've also used it with like a jet lag and stuff, and you know, regardless of what WebMD said, it actually helped me fall asleep when I was in like an 8-hour time difference. And where I was at, it was still light outside at like 10 and 11 at night, which was kind of weird. It looked like this outside at 10 or 11. But popping this, I did it like 2 or 3 nights in a row, then I was good to go after that. Otherwise, it may have taken a little bit longer for my body to adapt, and I would have had like a shitty first couple days of my body trying to figure out what the hell to do in a completely different time frame. So anyway, that was another good benefit of starting to take these. Right now, I take probably 2 a week, roughly, with no bad effects or anything like that. Except for, you know, if I do wake up a couple hours before my alarm goes off, I do have a hard-ass time getting back to sleep if I take half of one of these or a full one of these. So, back to why this can be beneficial when lifting. Well, just like I said, if you're trying to recuperate and you're either traveling, have jet lag, having a problem sleeping, or let's say you can only work out very close to bedtime, which isn't good because working out is good to help you go to bed, only if you do it during the day. If you do it right at night before bed, it tends to have an effect of keeping you awake longer. So if you work out hardcore, you have a big meal, and then you're trying to fall asleep an hour afterwards, something like melatonin could help. And then that lets your body start the recuperation time sooner than sitting in bed for a couple hours before falling asleep and then having to wake up the next day for work. So that's something that melatonin can be helpful for with lifting and trying to gain athletic performance and muscle and all that good stuff. So again, this is the one that I'm taking, and it is a strawberry flavored gummy, and the damn thing tastes just like a super tasty gummy bear or juicy fruit or whatever the hell some type of gummy strawberry dessert would taste like. So definitely don't sit here and get them mixed up with your gummy bears. But anyway, that is the run through on melatonin and what I've been using it for and some of the benefits and side effects you can get from it. This even says on the package, fall asleep faster. I agree, definitely. 100% drug free. Oh, well, that's good. Stay asleep longer. I'm not sure about that because if you wake up, you're fucked. But anyway, let me know your experience with it if you try melatonin. If you have any questions or comments, leave them down below. If you want to see any other information videos, check them out over here. And please subscribe over here. And alright, y'all, that's it for today. Peace.